Good morning. Hi, it's Dr. Om Schneider of the Ozark Chiropractic Clinic here today with another weekly video. And today, I was asking the staff some ideas because that's the challenge. I think is to come up with ideas to give you guys information. I want it to be interesting, I want it to be entertaining, and help you can learn something used to your good. So I asked them, they talked about condition. They mentioned sciatica. Because we have a lot of patients who suffer with sciatica. So some folks who have it know exactly what it is. Other patients who have never had it may have heard the term, not sure what it is, and some people have no clue what I'm talking about. So we're going to talk about sciatica. Okay, so what is sciatica? Sciatica generally occurs when we have a pinching of the nerves in the lower back. I even got some charts for us here to show you a little bit. So we're talking from the last two levels of the lumbar spine, L4 and 5, and the first two sacral levels, S1 and S2. So these four levels come together to form this big nerve going down the leg. It goes all the way to the foot. And what happens when it's pinched here in the lower back, generally that region there, you're going to get pain down your leg. And it could be a numbness, it could be a tingling, it could be a sharp pain, it could be excruciating. It can debilitate people. So that's how bad this can get. And it varies on everybody. So that's what we're looking at when we're talking sciatica. Now, sometimes you'll hear people also mention the term sacroiliac. The sacroiliac is the joint between the ilium and the sacrum. And it's a joint right here. So it's very close in line with where the sciatic nerve goes through. And in fact, oftentimes when there's problems in the low back, you'll have problems with the hips also. So you can have sciatic and sacroiliac problems there. So what do we do for sciatica? Well, first off, is we're going to do a thorough evaluation exam. We'll find x-rays. We're going to figure out what's going on. We're going to figure out where you're at and what results you want to see, because that's what's most important. We always want what's for you, what's best for you, and what do you want. So we're going to work there. After that evaluation, we'll lay out a plan to help you what we're going to do. And generally what we're going to involve is adjusting that spine. And there's different things we can do, okay? So what happens, let's see, usually at the L5, L4 level, sometimes we've got the nerve coming out from the side, that gets pinched, and that's what causes the leg pain. So when we work to adjust that part of the spine and the hips, we're reducing the pressure that occurs on that nerve and allowing the body to heal. Now we have another technique we call distraction. And that's a technique where you're on a table that lowers down the leg piece and it opens up the back of the space. I'll show you where the nerve and the disc is. So it'd be like this, you're laying on your stomach and you're opening up like that. And that opens up the pressure upon that disc and takes the pressure off the nerve. Because sometimes people say, well, if it's a disc, yeah, they shouldn't see a chiropractor. No, that's not true. We see lots of disc cases. You can handle them very carefully, and we do great success with them and avoid surgery, because surgery is not the answer. Most of the time, these things can resolve well over a long time, but they'll do better. Oftentimes with surgery, you're not going to see a lot of results. You may get a little relief from the pain for short term, but oftentimes in time it comes back. And then you'll have problems above the area or below the surgery, because those areas are going to start to wear more now too. So we want to make sure we use conservative care at all costs, and surgery is always the last resort, okay? What can you do at home? Exercising and things. First of all, taking care of your spine is the most important thing. Proper lifting, bending the knees, using good mechanics. Exercises, there's the pelvic tilt, there's the knee to chest stretch, the cat, the cow. Those are all simple things to help open up that space, relax that back, using the ice in home there. And then if it's been going on, you're going to need to see a chiropractor. That's going to be your best bet. Epidural injection shots, very limited effectiveness, very limited use. I've seen many patients who get them, they're just not that effective and stuff. And so we got to work through it. So that's what we can do for sciatica. So if you've had somebody say, I got some leg pain, yeah, most likely it could be sciatica. There may be some other things, but that's probably going to be your number one choice of what's going on. It can be treated effectively with chiropractic. If you have questions, please don't hesitate to give us a call, 667-5053. See what we can do to help you. Set up a consultation. There's no charge. If I feel I can help you, we will. If not, we'll refer you to somebody else. That's never a problem here. I know we can help. We've done it through hundreds of cases, thousands of cases, probably in my 30 plus years of practice. And so I know we're effective, know what we can do. Again, if you have questions, don't hesitate to call us. Check out our website. Give us a like on Facebook. But until next time, I hope you guys have a great day. If you're suffering with sciatica, give us a call. We can help you. All right? Have a fabulous day. Hope to talk to you soon. Thank you.